Hello friends, so I'm Dr. Himanshu Kataria. I'm Director Arthroscopy and Sports Medicine at Venkateshwar Hospital. I have interacted and have treated Mrs. Bibi Masooda, 52-year-old female. Now Mrs. Bibi actually presented to the hospital and presented to me with basically pain of the left shoulder, probably for the last 8 to 10 years. She was getting treated at the neurosurgery, getting treated at other orthopedic places, and it was a complete confusion whether we are looking at a shoulder problem or we were looking at a cervical problem. I got it as a referral from the neurosurgeons, and when I examined her shoulder actually showed a very significant restriction of the movements, and all the tests were positive for a possible injury to the rotator cuff, which is nothing but a strap of muscles of the shoulder which actually lifts the shoulder up. And because of that, I realized that she was in a lot of pain. Her night sleeps were completely disturbed, and she was not able to carry out most of her activities of daily routine. So we actually kind of planned out, we performed an MRI, and on the MRI we confirmed our findings which we actually saw clinically, and we planned out for an arthroscopic shoulder evaluation, keeping in mind that we'll probably go in for something which we call as subacromial decompression, where we actually clear the space just above the shoulder which was full of adhesions. So, to put it in a layman's term, she actually presented to us with painful frozen shoulder. That's what she actually presented, stiff shoulder. So we ultimately planned out and did the arthroscopic shoulder releases, and the biceps tendon which goes here was tenodized. It was fixed to the upper humerus. And she is now just about 4th or 5th day post-operative. Incidentally, she had some medical problems. She is a known diabetic and a known hypertensive. Both the conditions were not well controlled. So it took us about 4 to 5 days to optimize her sugar levels as well as her blood pressure levels. But with the help of our endocrinologist, we were able to optimize everything, and we performed the procedure. We kept her here for about 24 hours. And post-surgery, which she tolerated the procedure quite well. She is here with me today on the 4th or 5th day of the post-surgery, and she should, I would actually suggest, that we have a talk with Mrs. Bibi. Maybe she can tell our experiences better. So Mrs. Bibi, you can actually tell us.
Hello, I'm from Mauritius, 52 years old. In 2013, I got cervical pain. Due to that, I had to undergo operation at Mauritius Hospital. Big cage with 2 levels. Since that, I feel pain every day. I can't work, I can't do anything. This making me just to take painkiller and sleep. I can't do anything. Then I went to Omka. They sent me here in India by the foundation, and they referred me to you. And I did my surgery on 7 December, and now I can tell you I'm 90%.
So in fact, I tried to ask Mrs. Bibi if I put the score of your pre-surgery pain as 10 on 10 or 9 on 10 was the severity of your pain. What would you rate the pain now?
2 on 10.
So it's about 2 on 10 now. So I think I would say she's done very well for herself, and I am very happy with the kind of result that I've got. Today on the 5th day, we were able to get almost 70-80% of her movements back on the shoulder. So for one, I'm personally quite happy, and I think the most important thing is for Mrs. Bibi and her daughter, who speaks a little more than Mrs. Bibi. Maybe you can talk to them and tell us your experience about your mother. Yeah. So, okay. So daughter probably is more shy than the mother, I think so.
You can speak in Creole.
You can speak if you want to. So maybe your experiences. Okay. So that's fine. So Mrs. Bibi, now you have been actually told to go for some physiotherapy. So I think we will do that, and once she goes back to Mauritius, she continues doing, so that whatever benefits we've achieved post surgery should actually continue. And we hope to see her, soon when she comes for her follow-up, maybe in the next 2 months or 3 months.